Hello, and thank you for joining me. My name is Cynthia Yuan, and this presentation highlights the findings of my narrative review titled Outpatient Strategies to Reduce Acute Care Use in Pediatric Asthma. In this presentation, I'll walk you through the context, methods, and key findings of this review and offer some practical implications for community-based asthma care, particularly in the Canadian setting. To begin, let's look at why this topic is important. Asthma is the most common chronic respiratory disease in children, affecting over 12% of Canadian children. While it can be managed in outpatient settings, it remains a leading cause of emergency department visits and hospitalizations among pediatric populations. This has profound implications not only for children's health but also for families and healthcare systems. Each year, asthma costs the Canadian healthcare system over $2 billion, largely due to preventable acute care use. Children who lack regular access to coordinated outpatient care are at higher risk of poorly controlled asthma. In particular, children from underserved populations, including those living in rural areas or experiencing systemic barriers, often miss out on follow-up care, asthma education, and environmental supports. This evidence points to an urgent need for more effective outpatient strategies, especially those are community-based, coordinated, and equity-oriented. Next, let's explore the main strategies that emerged from the review. First, structured follow-up and coordinated care were identified as critical components in reducing repeat emergency department visits. Without clear discharge instructions or defined care plan, families often struggle to manage asthma effectively after an acute episode. While follow-up visits, such as those within 30 days of discharge, improve access to medications, they did not always lead to fewer emergency department returns, likely because these encounters lack personalized action plans, clear care navigation, or strong communication between providers. The most effective interventions were those embedded in broader team-based care models, particularly those involving community health workers and interdisciplinary teams, which helped ensure continuity, support, and accountability across care transitions. Second, education and self-management support were found to be most effective when tailored to both caregivers and children, and also when integrated across home, school, and clinical settings. These interventions enhance caregivers' ability to manage asthma by improving their understanding, building confidence, and reinforcing skills through ongoing guidance and support. When paired with motivational strategies or implemented in familiar environments, education helps translate the knowledge into daily practice. This, in turn, empowered families to monitor symptoms more effectively, adhere to treatment plans, and reduce the likelihood of acute episodes. Third, community and school-based models stood out as particularly effective in improving asthma outcomes and reducing reliance on acute care. By delivering services in familiar environments, these models reduce logistical and cultural barriers that often limit access to care. Programs led by community health workers were especially impactful as they offer culturally responsive support, build trust with families, and help bridge gaps between clinical and community systems. These locally integrated approaches not only improve system control but also promoted sustained engagement by meeting families where they already live, learn, and access services. Fourth, digital tools such as mobile apps and telehealth platforms offer flexible and scalable support for asthma management, including education, symptom tracking, and follow-up care. When integrated into clinical workflows and supported by providers, these tools enhance engagement and accessibility. However, their impact was not uniform across all populations. Digital inequities, such as limited access to devices, internet connectivity, or digital literacy, can prevent families from fully benefiting. To ensure digital interventions are effective and equitable, they must be paired with strategies that address these structural barriers. Fifth, caregiver empowerment emerged as a critical factor in effective asthma management. Interventions that prioritize clear, culturally appropriate communication and considered caregiver literacy were more successful in building trust and confidence. When caregivers felt informed and supported, they are better equipped in implement treatment plans consistently, recognize early warning signs, and manage symptoms proactively, ultimately reducing reliance on emergency care. 6. Data-driven planning played a pivotal role in ensuring that interventions reached the communities most in need. By leveraging tools such as geographic information systems and healthcare utilization data, programs were able to identify pediatric asthma hotspots and allocate resources more strategically. These data-informed approaches supported the design of targeted, community-specific interventions, helping to reduce disparities and improve care delivery in underserved areas. Building on the 6 strategies, several characteristics consistently emerged among the most effective interventions. Multi-component programs. Those combining asthma education, home visits, environmental remediation, and care coordination produced the most robust outcomes. School-based delivery models were especially impactful because they leveraged daily contact with students and maintained established relationships with families. These programs often incorporated asthma education and facilitated communication between caregivers, schools, and healthcare providers, making them well positioned to reinforce management strategies and promote continuity of care. Community health workers also play a vital role in high-performing models. Their cultural familiarity and trusted presence enable better communication, follow-through, and sustained engagement among families navigating complex care needs. Digital solutions such as mobile apps show promise when integrated with clinical care and personalized supports. These tools helped improve knowledge and adherence, but worked best when reinforced by provider interaction and follow-up care. Lastly, caregiver-centered interventions that prioritize motivational communication, accessible materials, and consistent reinforcement contributed to greater caregiver self-efficacy, which in turn supported more stable asthma control at home. Despite these promising practices, several significant gaps persist, limiting the effectiveness and scalability of outpatient asthma interventions. First, care systems remain highly fragmented, with poor coordination between emergency departments and primary care providers. Families are often left to navigate transitions in care on their own, which can lead to confusion, gaps in follow-up, and delayed or missed opportunities for ongoing asthma management. Second, while digital tools offer strong potential to enhance asthma education, monitoring, and follow-up, they may unintentionally widen existing health inequities if underlying structural barriers are not addressed. To ensure equitable impact, Digital health strategies must be accompanied by efforts to improve accessibility and build trust with underserved communities. Third, relatively few studies evaluated long-term outcomes or program sustainability. While many interventions demonstrated short-term improvements in asthma control or emergency department use, there is limited evidence on how these models perform over time or how they can be scaled effectively across diverse settings. Moving forward, there is a pressing need for implementation strategies that foster continuity across systems, close digital access gaps, and support sustained engagement with families over the long term. In addition, future interventions should focus on intersectoral collaboration, especially among healthcare, education, and social services. We also need to invest in sustainable infrastructure, support caregiver capacity, and ensure equitable access to digital innovations. To wrap up, this review shows that well-designed outpatient asthma strategies can reduce emergency visits and improve outcomes for children. The most effective approaches are community-based, including multiple components, and focus on equity. These programs succeed because they meet families where they are through follow-up care, caregiver support, school-based services, and data-informed planning. There's a clear opportunity for Canadian health systems to apply these lessons and invest in coordinated asthma care that reach all children, especially those facing the greatest barriers. Thank you.